Well, good afternoon, everyone, and I do appreciate this opportunity to talk to you about new approaches to care for young adults with life-threatening conditions. And in this presentation, I'm going to introduce you to this new population to adult palliative care, the impact of transition from pediatric to adult services, and some new approaches to care. There's the outline there for you. So on their 18th birthday, young adults who've had the opportunity to experience an incredibly connected and supportive network of pediatric health, education, social, and palliative care are disconnected from these resources. So these young adults leave behind an integrated and total approach to care that enhances their quality of life through attention to their developmental needs. So there's a growing population of young adults with palliative conditions because of earlier diagnosis and improved treatment and management, and this is leading to longer rates of survival and a delay in the onset of end-of-life symptoms. While we don't know the number of youth with life-threatening conditions in Canada, in the UK this population has nearly doubled since 2002. This diagram demonstrates three common attributes among young adults with life-threatening conditions. Their conditions are highly complex, with highly complex symptoms. They have progressive palliative conditions over sometimes long periods of time, and they're unstable. And this instability increases now in their young adulthood years, where previously it would have been in their adolescence. So in terms of demographics, young adults with palliative conditions cover a spectrum from those with profound developmental delays to those who are able to attend university. Many of these young adults have lived with their conditions since childhood, and others will acquire their life-threatening conditions in their young adult years. Their life expectancy varies. Many are not expected to live past their first decade of young adulthood, which is kind of 30-ish. And the types of conditions they have include the neuromuscular, which, for example, is Duchenne's muscular dystrophy or spinal muscular atrophy. And for those of you that may not be as familiar with their conditions, a snapshot of a young adult with Duchenne's muscular dystrophy would be someone who requires 24-hour attendant care, and their independent functions may be reduced to minimal movement of their index finger on a joystick that controls their power wheelchairs, their computers, and their phones. And for many, if their arm is knocked off their wheelchair control, they may or may not be able to independently move it back onto the chair. Nearly all these young adults will have to decide if they want to be ventilated when they become too weak to support their own independent breathing. The other kind of conditions these young adults have include some metabolic conditions, cancers, and there just is a whole potpourri of undiagnosed and rare conditions that clinicians might see one in their whole career. So they just make up this subset that have conditions that are not well known to anybody. So as an example, this young woman's description of her own rare condition crystallizes the extraordinary challenges many of these young adults face. And these are her words that I'm reading to you. She says, "I have a very rare condition with severe complications. It means I'm very bendy. My joints dislocate easily and frequently. I live in chronic pain. My muscles are weak. My autonomic nervous system doesn't work, and my gut and bladder have failed. As you can see, I'm in a wheelchair. What you can't see is the line on my chest that goes into my heart, the tube that goes into my stomach, the stoma bag on my abdomen, and the catheter going into my bladder. You won't see the medication and nutrition being pumped into my heart, or the body that struggles to do even basic things. You can't see the pain, the fatigue, my racing heartbeat, or low blood pressure. Though you will see me with a smile on my face, hiding all the horrific things going on inside my alien body." So despite conditions like this young woman, they do aspire to regular young adult goals. Many hope to attend college or have meaningful work, vocation, or volunteer opportunities and live independently. But they do face extraordinary challenges to live ordinary lives in a short time. So for these young adults, their life becomes a paradox, and this is from some work from my research and doing interviews with these young adults. is that you can see by the diagram that their desired developmental trajectory is like any other young adults, where they're moving forward, they're setting goals, have things that they want to do, but their actual health trajectory at the end of life has this collision for them. And you can see in the top line that goes down their actual health trajectory. Sometimes it's a very precipitous, and then sometimes there's large losses over time and then plateaus. But it often is very, can be quite unpredictable when that's happening. One of the most ironic paradoxes is for those that were in pediatric palliative care, these same palliative, respite, and hospice supports are not available to them in the adult system when they'll be needing them the most. And that's because young adults' kind of conditions, similar to older adults with COPD and chronic cardiac conditions and others, they don't fit within some of what has been the mandate or philosophy of adult palliative care, which can focus on specified time periods in the last weeks or months of life. So the current outcomes, the advances in technology and healthcare have increased their life expectancy, but there are few comparable health and social services to support their complex and palliative conditions in adulthood. That results in reactive rather than proactive care. There's a necessity to have expertise in the conditions of these young adults to understand what the meaning of changing symptoms, approaching end of life, and decision-making support, like about choosing to be ventilated or not when they're no longer strong enough to breathe on their own. The care needs to be proactive rather than reactive because of their increased vulnerability, unmanaged symptoms, medical crises, and unplanned deaths that occur in acute care hospitals or extended care facilities. After leaving specialized pediatric care, these young adults are hopefully attached with a family practitioner, and they have a series of specialists, but no one who's doing that coordinating care and looking at the overall impact of these symptoms. So they often get this sort of episodic acute response to the symptom, but not with an overlying understanding or preparation for what those symptoms mean. So is age-appropriate care a luxury or a necessity for this population? Currently, young adults with palliative conditions face several problems in the adult system. First of all, they lose contact with healthcare professionals and the coordinated health services to manage their unpredictable disease trajectories, resulting in increased risk of deteriorating health. And there are few healthcare professionals in the adult world that have had training or experience in anticipating these young adults' anticipated needs and coordinating their care. But it's not all about medical care. The needs of young adults with life-threatening conditions are different than those of young adults because of their specific developmental goals. They are really concerned with living their life, and the experiences of young adult hospice in the UK is, for example, an event that would bring together these young adults might be something like going to a music concert for a weekend, and they take along power wheelchairs, ventilators, feeding tubes, lifts, all the equipment that they need to do. But this is part of what sort of living at the end of life in young adulthood is all about. And they really want to be meaningfully engaged with their peers and their community, which includes things like getting together for a pub night or attending a concert, and having respite from their parents and caregivers as well. The social and community engagement is necessary. Many of these young adults experience isolation. Either they're living with their parents and unable to access the circles of connection that they were part of while they're in school, or for some of them, their parents are unable to continue to care for them, and they live in extended care facilities with residents who are 5 or 6 decades older than them. And without specific social support, many of them have few opportunities to live life firsthand. Without supportive networks, they can become voyeurs of life rather than participants of their own life. They observe what other young adults can do, like going to concerts, hanging out with friends at a party or bar, traveling, but they don't really have the opportunity to experience it themselves. And in terms of education, in addition to the financial costs, there's significant personal costs to pursue their dream of going to college or university, One is whether they will stay well enough to complete their degree. Another is to overcome the huge hurdles and barriers that are put up to them to actually access the university or college. But while they're at university, their time to hang out with friends and family is compromised while they focus on their study. And as one young adult in my study told me, she said, like other students who are at university who are focusing time at university to have reap the benefits later, she said, I don't have my life ahead of me to look forward to do the things that I'm missing out on now. So what would young adult palliative care look like? The developmental journey of young adults with life-threatening conditions is different than older adults at end of life. And although specialized palliative care is receiving increased attention as our aging population seeks to avoid a painful or undignified end of life, young adults with life-threatening conditions require a different approach, and I'll call that a palliative approach to care, which is becoming more recognized in the UK and progressive communities. And it better matches their chronic disease trajectories of a series of declining plateaus over a period of months and years that's punctuated by unpredictable crises. So in a palliative approach to care, the professional disciplines, community organizations, and volunteer sectors join together around a set of goals that include not only health, but really focus on their well-being and social context. So, for example, for young adults, this would include their power soccer teams, mentors from literary and arts communities to support their writing and unique artistic endeavors. Other, groups and organizations that are more community-based than health services, which we focus on more. And with these kind of resources, there's more opportunities for these young adults to achieve their goals more than just to be kept comfortable in managing symptoms as they arise. So recommendations for change. First is that care that moves beyond healthcare needs and recognizes the full range of young adult developmental needs. So this requires a policy approach that moves beyond healthcare needs and recognizes their full range of needs. It's been demonstrated that nurse-led multidisciplinary teams provide the most effective clinical programs for patients with chronic and complex conditions requiring complex solutions. So this includes the infusion of palliative philosophies into primary care. So instead of palliative approaches being designated specific specialists at end of life, an encompassing approach to care will consider their quality of life, personal preferences, and life goals, rather than episodic management of presenting problems. And there's been a good success using nurse navigators, care coordinators, and key workers in this work. It's really important, given that this population is new to the adult world, that education and consult support is given to the adult providers from the pediatric world. So the sense of collaborating with pediatric providers is essential. And one of the key things about this is in the pediatric world, these young adults are known for who they are. They're not just a collection of symptoms and problems. And some of the best adult palliative providers are understanding this, that the youth, young adult needs to be known for who they are. So some of them take an active role when they're making this transfer from the pediatric adult world, as they've got all their medical information and other services, but they want to know, who are they? Tell me something about them to help create that attachment. In the pediatric world, these kids have been known for 20 years, 18 to 20 years, and now the adult provider is needing to make a very quick attachment, which can be difficult to do. So in any way that the pediatric world can support the adult world in understanding who they are and helping the young adults feel comfortable. And I like the analogy of the attachment process to the adult world. It's like taking an airplane. You get ready to go and you're in the plane, you taxi and leave the gate. That's kind of like the transition preparation that happens in the pediatric world. And then you take off. And that's always a pretty bumpy part of the flight process. And that's when you leave pediatrics and first begin visiting adult providers and kind of normalizing that it's going to be a little bumpy at start, but once we get some altitude, we're going to be good. And the flight takes on, and then the landing part is really the key part. And the landing is making a smooth connection with the ground, or building an attachment and trust between the adult providers and the young adults. Again, this is just reiterating the resources to support their larger context of health and well-being in their quest to maximize opportunities in an abbreviated time frame. So now we're on the next slide. What could a palliative approach to care look like for young adults? It supports attachment to adult services. It empowers young adults and their families to ensure their voices are heard, supports young adults' independence, life choices, being with friends, access to work and education opportunities, provides respite care to reduce the strain on families from the constant cycle of care that's needed. It improves well-being for young adults. And this is in addition to all the current palliative supportive strategies in place for other populations that provide good symptom management and support at the most critical times. And I want to tell you about Pathways Young Adult Hospice, and this is a new society that's been formed. I'm working with clinicians at Canuck Place, and we are looking for young adults to join us. We have one parent, and we're also looking for partners in the adult team to work together. And we've just formed a society, and our overall goals are to provide specialized care and consultation to bridge the gaps. So this means identifies that for young adults, there's different issues and complications than for middle-aged or seniors in caring for this group. It means about going to school, getting a job, being in relationships. It means we recognize that there's these rare and unusual diseases that don't fit usual categories, that this care can span years and it can change over time. And that hospice admission cannot just be about when you're actively dying. It's about the months and years that are leading up to that. And in terms of raising awareness that it can be better, currently this population is underserviced, they're suffering, they're not dying well, and families are traumatized by their end of life. And the young adults are a population in the middle of the family tree, which has a wide impact on communities and systems. Teams that are caring for them are stressed. There's no training at this time for palliative young adults. And some of these young adults end up in senior care homes, which is inappropriate developmental place for them to be. And our third goal is to build community to support the journey ahead for young adults and their families. So supporting them in leaving the pediatric world and navigating a whole new system that's designed for adults. And to help them prepare for adult systems that expect independence and self-directed care and the health challenges they may experience in this new system. Another current initiative is a project called Bridging the Gap, a palliative approach to care. And we have just received funding from the Canadian Institute of Health Research to develop a strategic plan for this palliative approach to care. And having experienced the challenges of transition and adapting to this healthcare system that was not designed nor equipped to meet their needs, the young adults and their parents are invaluable team members and collaborators with us in determining what this new direction will be. And we're working very hard to include the young adults and parents, along with both pediatric and adult health, community services, organizations, programs that would have some interest in providing support and creating a compassionate community for these young adults. And it will also provide opportunities for social engagement and personal empowerment. So the plan of this study is to begin a dialogue with young adults, their families, and caregivers, and the other professionals and service organizations in activities to shape this approach. So we'll be listening to their ideas about how to improve palliative care through a three-phase concept mapping process, where the first two phases are online, and will be open to people to put suggestions about what we'd like to do. There's a second qualitative phase of doing some coding and sorting of all the data that people provide. And then the third phase will be a face-to-face meeting with young adult parents and all of the community of care providers in both pediatric and adult world to look at what this concept mapping process, which is actually a software tool that will help us create a map and some priorities and feasibility of the priorities of care as we move forward. But the key part of that is that the young adults and the parents will be very instrumental in determining what these key priorities and strategies should be. And I'm very welcoming of anyone who would like to be invited into this research process. I like to conclude every presentation with this slide, which is a picture taken by one of the young adults in my study. And she said this picture is like her life. She said, while the journey is uncertain, she anticipates some beautiful moments. And through my work and study with these young adults, I have an enormous admiration for their strength, their perseverance, and their wisdom. And all of this work and research is dedicated to them, with the intent that by telling their stories, transformative system changes will support their courageous and creative life investments. And I thank you for your interest, and I look forward to discussion with you and your perspectives and your observations and good suggestions.